Hey everybody, it's Dr. Piefler. I'm in an undisclosed location in an undisclosed hospital, and this week I have had some pretty interesting experiences. I've had to work at a psychiatric facility, or at least do some admissions at a psychiatric facility while doing my normal hospitalist duties. And I'm not sure if we've talked about vitamin D in the context of mental health, but there's a huge association between vitamin D and depression, anxiety, etc., and as well as B vitamins, especially B12 and folate. And so all the patients that I've admitted who have had like severe depression, anxiety, suicidal ideation, or even suicide attempts, I've checked it on, and I have not seen one person have a vitamin D level that's normal. And I've not seen, well, I've had a couple people who had normal B12 and folates, but for the most part, I've seen rock bottom B12s and folates, and I think this is definitely contributing to these admissions, no question, and their mental status. So I know one of my patients, Heather, had asked me to do some videos on B vitamins and vitamin D in context of mood disorders. So I do want to cover that at some point. But actually, even though I was planning on talking about this, I've actually been catching a lot of high homocysteine levels in people with coming in with chest pain, with sorry, my battery's about to die, with chest pain, with acute MIs, or heart attacks, and stroke-like symptoms. And so we always check B12 and folate on people with strokes, but I've been checking it, including homocysteine, on people with the same vascular events. And I've been catching a ton of hyperhomocystinemia, or people who have high homocysteine levels, which is basically a vascular toxin. And so this is definitely something I want to cover in a future video about the importance of methylation, methylators, specifically B12 folate, B6, SAMe, and several others, and how important it is to help keep your homocysteine levels down to help prevent a risk factor for vascular disease. So just wanted to check in. I've been pretty busy at the hospitals, and I do want to cover these topics, and very soon. Until next time.